client with pain and discomfort, which task is most appropriate to delegate to a unlicensed assistant personnel? Is it 1, assisting the client with preparation of a sitz bath, 2, monitoring the client for signs of discomfort while ambulating, 3, coaching the client to take deep breaths during painful procedures, or 4, evaluating relief as applying a cold compress? So if you chose 1, you are correct. So the UAP can assist the client with hygiene issues and knows the principles of safety and comfort for this procedure. Monitoring the client, teaching techniques, and evaluating are the nurse's responsibility. Which clients can be appropriately assigned to a LPN who will function under the supervision of a RN or a team leader? Select all that apply. Is it 1, client who needs preoperative teaching about a PCA pump? Or is it 2, a client with a leg cast who needs neuro checks and as needed PRN hydrocodone? 3, a client who underwent a toe amputation and has diabetic neuropathic pain. 4, a client with terminal cancer who has severe pain who is refusing medication. 5, a client who reports abdominal pain after being kicked, punched, and beaten. Or 6, the client with arthritis who needs scheduled pain medication and heat applications. So this is a select all that apply question. So if you chose 2, 3, and 6, you are correct. So the clients with the cast, the toe amputation, and arthritis are in a stable condition and need ongoing assessment and pain management that are within the scope of practice of an LPN. The RN should take the responsibility for pre-op teaching, and the client with terminal cancer needs a comprehensive assessment to determine the reason for refusal of medication. The client with trauma needs serial assessments to detect occult trauma. A client has severe pain and bladder distension related to urinary retention and possible obstruction, and experience UAP states that she received training in indwelling catheter insertion at her previous job. What task can be delegated to the UAP? 1, assessing the bladder distension and the pain associated with urinary retention. 2, inserting the indwelling catheter after verifying her knowledge on sterile technique. 3, evaluating the relief of the pain and bladder distension after the catheter is inserted. Or 4, measuring the urine output after the catheter is inserted and obtaining a specimen. So the answer is going to be 4. So we're just going to have that CNA measure the output and they can collect a specimen. When care assignments are being made for a patient with alterations related to GI cancer, which patient would be most appropriate to assign to an LPN under the supervision of a team leader RN? 1, a patient with severe anemia secondary to a GI bleed. 2, a patient who needs enema and antibiotics to control GI bacteria. 3, a patient who needs preoperative teaching for bowel surgery. Or 4, a patient who needs a central line insertion for chemotherapy. So if you chose 2, you are correct. So administering enemas and antibiotics is within the scope of practice of LPNs. So although some states and facilities may allow LPNs to administer blood, in general, administering blood, providing pre-op teaching, and assisting with central line insertions are responsibilities of the RN. The nurse manager in public health department is implementing a plan to reduce the incidence of infection with HIV in the community. Which nursing action will be delegated to the UAP working for the agency? Is it 1, supplying injection drug users with sterile injection equipment such as needles and syringes. 2, interviewing patients about behaviors that indicate a need for annual HIV testing. 3, teaching high-risk community members about the use of condoms in preventing HIV. Or 4, assessing the community to determine which population groups to target for education. So if you chose 1, you are correct. So supplying sterile injection supplies to patients who are at risk for HIV can be done by UAPs. A patient who has received a kidney transplant has been admitted to the medical unit with acute rejection and is receiving IV cephalosporin and the steroid, methylprednisolone. Which staff member is best to assign care for this patient? Should you give the patient to a RN who has floated to the medical unit from the coronary care unit for the day? 2, a RN with 3 years of experience in the operating room who is orientating into the medical unit. 3, a RN who has worked on the medical unit for 5 years and is working her double shift today. Or 4, a newly graduated RN who needs experience with IV medication administration. So if you chose 3, you are correct. We want to give it to the nurse who has experience on that floor. Even though she is working a double shift today, that does not say that that nurse is incapable of taking care of that patient. So you don't want to read into the question saying, oh, she may be tired. No. A client with chronic pain reports to the charge nurse that the other nurses have not been responding to the requests for pain medication. What is the charge nurse's initial action? Is it 1, check the medication administration records for the past several days? 2, ask the nurse educator to provide an in-service training about pain management? 3, perform a complete pain assessment on the client and take a pain history? Or 4, have a conference with staff nurses to assess their care for this client? So the answer is going to be 4. So the charge nurse must assess the performance and the attitude of the staff in relation to this client. After data are gathered from the nurses, additional information can be obtained from the records and the client as necessary. The educator may be of assistance if the knowledge deficit or need for performance improvements is a problem. But first, you want to figure out what's going on with the nurses and why they're not giving